So, Namaskar Sathiyon, good evening to one and all present here. I, Nandini, a student of JCD Vidyapeeth's JCD Dental College, studying in BDS third year, welcomes you all to our YouTube and Facebook channel. So, आज आप सभी की request पे, I have none other than Dr. Deepak Puri, who doesn't require any introduction, but to your notice, I'll bring here that he is the global chairperson, the founder chairman of Cardio Immersion, that is a global group promoting integrated approach to comprehensive cardiac care started by him in 2011. So what Sir believes is that heart and lifestyle diseases are the leading causes of mortality and morbidity nowadays. There has been tremendous improvement in the management of cardiac diseases and advancement in techniques of cardiac surgery, cardiac anesthesiology, and related cardiac disease, and related technologies as well as comorbidities which are associated with the cardiac diseases has necessitated the need for developing an integrated approach for the management of such patients. Cardiomersion organizes events, workshops, and bring updates regularly and organizes global conferences to achieve uniformity in management of cardiovascular disease menace. Sir, on the behalf of entire JCD Vidyapeeth's family, I welcome you here and thank you for giving us your valuable time.
Thank you so much. Very good evening to everybody.
So, sir, there are a lot many questions. From the time I've posted the update that you'll be here on our channel, many students and including our faculty members has approached me with a number of questions. So I have a list, and we'll have a very pretty good discussion with a knowledgeable approach here today. So, sir, first of all, I would like to ask you, what is cardiomersion? Like, I introduced it, but I want to hear it in your ways, like in your words, that what actually cardiomersion is.
Actually, cardio means anything related to the heart, and merger means merger of all the specialties which can work together to improve the function of the heart and the heart health. So actually, I started this global group in 2000. For a long time, I used to see that most of the patients who come to us, they have various other comorbidities also apart from the heart disease. So they may be having diabetes, they may be having renal failure, they may be having stroke, or they may be having some lung dysfunction. So it is not just possible for just one specialty to take care of patient. Apart from that, we have to take care of the dietary aspects, also the physical activity, and most of the lifestyle diseases like heart disease, diabetes, hypertension, cancers, which are related and they have common risk factors. So in order to deal with all the risk factors, we have to have a team approach. Apart from that, I saw that most of the patients, they come to us only at the time of intervention. So we were practicing intervention based medical care, in which the person used to fall ill, come to the hospital, and then get the treatment. But patients were ignoring, and even the doctors were ignoring the preventive aspects. So a lot of prevention is involved in the management of the disease. Even before the onset of the disease, what we call the primordial prevention, and then when the risk factors are acquired, then we follow the primary prevention, and after that we have to give the patient proper treatment by diagnosing the disease early, and then only later on, if we are not able to control the disease by simpler means, then only they come for the interventions. And even if we do the intervention, after that the patient has to be given a proper rehab, and after the rehabilitation the patient has to still follow the secondary prevention. So if we have to complete the entire process, then we need support of so many other and it is possible only with the help of a team approach.
Really, sir, because as we all know, we've been studying since class 8, like prevention is better than cure, prevention is better than cure. But then never, it's a really good, it's really a very good initiative. Like,
It is
and I think
actually
it
better
should be
than
very
cure
much
because
popular. Yes, sir.
It not only prevents the complication, it is much cheaper. So if we
Hmm.
prevent a disease, we just require to follow simple lifestyle changes. But if we have to treat a disease after the complications, then not only the cost of the disease, the risk factors also increase, and the process becomes much more complicated.
Exactly, sir. It's really a very good initiative, and I think the youngsters who are watching us, they should adopt this method as fast as they can and should be a part of your family to make it more bigger and to carry it to every street and every house so that we have less number of complications in the future. So, sir, next I would like to ask, like I stated that you organize some events and workshops. So, what are your like if we consider the younger generation, that what are your future goals? Like, what do you want to target next?
Actually, we have seen that Indians they get the disease at a much younger age compared to the Western population. Many Indians they get the disease even in their second or third decades. Most of the patients who get their first heart attack they are younger than 50 years in India, and almost 50% of the patients they are below 50 years when they get their first heart attack. So if we compare to the Western population, most of the patients who get a heart attack they are above 65 years of age. So the concept that people used to think is that you take care of your health after you cross 40 or 50 years of age. That doesn't hold true for Indian population, because Indian population they are coming to us even in their mid 20s and 30s with heart attacks. So that means that we have to start taking care right from the childhood. So if we start the process in the childhood by primordial prevention, and follow the same throughout the life, and it has to be done and by under expert supervision. You can't just like people nowadays they are belonging to two categories: one who just don't bother at all, and suddenly in the emergency they come with the major heart attack or stroke. Even I have operated young patients, 24-year-old girl also, and 28 to 30-year men who come to us in emergencies. And then we that time think that this could have been prevented. So initially we focused on making people aware. We used to hold workshops in colleges, universities, and nowadays, like because of the COVID, we are not able to hold live workshops. So we are doing. So next step would be that we would involve all the youngsters, and then we would together spread awareness, because just one person spreading the awareness or my team members spreading the awareness is not enough. So I want that people, youngsters should come forward and they should join us, and we should together make it a global movement, because already we are getting a very good response abroad. So every year in 2013, I organized a conference in Orlando, and after that we organized two times in Japan, and we organized in Tokyo and Obihiro, and then we have organized in Singapore, Dubai, and many other places. So want that in India also we keep on organizing events and workshops, and we have a YouTube channel also. So I think if everybody joins hand, because it affects globally everybody, and especially the Indian population, they are affected at a much younger age. So if we join hands together and we spread it, then uh, we can make everybody aware about the preventive aspects also, and we also make the youngsters aware about the latest updates in the technology, because many times people they get carried away by myths, and also nowadays there's a lot of controversy between the conventional methods, like people say that yoga can cure everything. No doubt yoga has got so many benefits, so we incorporate the scientific benefits of yoga and place them according to the actual place where they would be beneficial, like in the primordial prevention, in the primary prevention, in rehabilitation, secondary prevention. But when a person needs some actual treatment and actual intervention, at that time we follow the what is the best possible method to save the life of the person.
It's really very nice, sir. As you said, like you have done many. The award speaks, sir. Pride of Nation Award in 2020, Shan Hindustan Award. Like I was going through your website, so I found these many awards. So I would request all the viewers watching here that Cardio Immersion's website is currently displaying on the screen. You are regularly getting the updates, and we'll mention the YouTube channel's link in our description. So please go and check it out and do connect with them to avoid your lifestyle disorders and to curb the menace of these cardiovascular diseases. So, sir, next I would like to ask you that what are the various ways to reduce the cardiac diseases? Like you are talking about key reduction hona chahiye, prevention is important, this is important. But if a person is prone to such disease, then what are the ways in which we can reduce the after effects? In which we can, reduce the effect of that disease.
Actually, heart diseases, they cause more than 17 million deaths every year, and the leading cause of death. Almost one third of the deaths they are because of cardiac diseases. And the coronary artery disease, that is the blockage of the coronary arteries which supply blood, that is the most common cause of death. So the process of blockages, it starts in the first few years of life. The atherosclerosis process, people believe that it may start in the later on in old age or middle age, but actually it starts in Indian population. We did a survey in which we examined the coronary arteries under the microscope of those patients who were brought for. We found that above the age of 22, everybody had the of atherosclerosis in their coronary arteries. And it was very alarming, because if we compare to a similar study which was done in the Asian population somewhere else, and they found that even at the age of 70, 25% of the people not have evidence of atherosclerosis in their arteries. So you can imagine that in Indians, fast it starts the onset, and then how fast it will grow depends on their own risk factors. Some of the risk factors, they are non-modifiable, because like they are hereditary, or because of the race. Like Indians, they are most prone to the coronary arteries, and they are prone at a much earlier age. The chances of Indian having a second heart attack within 2 years is also much more higher compared to the Western population. So these things we cannot change, but we can change our lifestyle, and we can change the acquired risk factors. So these are the modified factors, like your physical activity, your dietary control, stress management, and so many other things. Like if you monitor your blood pressure, you monitor your sugar levels, can take of that. And is nowadays a major cause of morbidity and death. So if we control our weight, if we remain fit, then we can prevent future diseases at a uh, very early. We can detect them, and we can even treat them properly, and we can later on have a very healthy, longer life with a longer health span.
Great, sir. I would like to add on a line here that youngsters should be beware of the heartbreaks, heart failures. 1 week ka breakup should not affect you. Your heart is important, not those breakups are important.
That is very important, because it simulate heart disease, and after a breakup, what is called is Takotsubo cardiomyopathy. So we can have similar features, like a person may be having features that may make the heart attacks. So, but it is transient, and we can overcome it with some emotional support, and only few people, they will require medication for that.
So, at last, a message for the JCD's students, JCD Vidyapeeth's faculty members, a message from your side at last. I would request you to deliver a message for all of them.
Sure, I would like to encourage everybody to take care of their own lifestyle and also to encourage their friends, their relatives, and their families to follow a very healthy lifestyle and just spare half an hour for themselves so that they can take care of this. And simple formula they can adopt is that at least they should do half an hour of physical activity like simple walk, that is enough to keep them healthy. They should not take high quantity of fried food, junk food, cold drinks, because all of these they affect the health. And they should take more of fruits and vegetables, and they should remain happy because various surveys and various has shown that it doesn't matter how rich you are, it doesn't matter how powerful position you have. What actually matters is how good relation you have, and if you are in a good relationships with your family, with your friends, then definitely you will have a longer and healthier life. Avoid so many lifestyle diseases. Thank you so much.
Exactly, sir. So at last, I would request all the viewers that Dr. Deepak Puri is director at cardiovascular thoracic surgery and global in cardiomergen, as we all know now. His contact number is regularly coming on the screen. You can always take a screenshot and you can have a video consultancy with him also. He's currently at Max Super Speciality Hospital, Mohali. Am I right, sir?
Yeah, sure.
Sir, thank you for giving us your valuable time. Uh, a
My
heartfelt thank you
it's a
from
great.
entire JCD Vidyapeeth's family. We are lucky to have you
Thank you
here,
so
sir.
much. Thank you so much. It was my pleasure to be with you today and be able to convey my message to your entire group. And I hope that you will join hands with us and we will spread this message throughout the world.
Okay, sir. Thank you.
Okay, thank you. Thank you.